Hello, my name is Tracy Hollingsworth. I'm a clinical educator for Texas Health. The prevention of CLABSIs is an initiative by Texas Health to reduce hospital-acquired infections. Prevention of CLABSI is also a key performance improvement measure for the culture of excellence at Texas Health. According to the CDC, 1 out of every 4 patients with a CLABSI will die. Most CLABSIs and catheter-associated bloodstream infections happen during dressing changes, needless connector changes, medication administration, and also during peripheral IV insertion. In this video, I'm going to be using the guidelines from the Reliable Care Blueprint on Prevention of CLABSI and also Texas Health Vascular Access Device Management and Care Policy. We're going to be changing this mannequin central line today. All right. First thing you want to do is we're going to explain the procedure to your patient. Make sure they don't have any allergies to tape or sensitivity to tape or Tegaderm or CHG. Okay. We are going to get a kit. We have a dressing change kit specific for each line your patient may have. This one's for central line. There's also a specific kit for ports and for PICCs. You just read the label and it says central line. Okay. All right. The first thing that I'm going to do is cleanse my hands, don some gloves, and clean my area. I want to have a clean work surface to work from to set up my dressing change kit. All right, I'm also going to let this dry completely because as it's dry, that's when it's killing the germs or the bacteria. The killing time is in the drying time, that's what they say. All right, I've doffed my gloves. I'm going to hand hygiene again. All right, grab my kit and we're going to peel it open. All right. All right, the first thing you'll see is the label. It says central line, and that's what we need. You'll also come to some instructions, a checklist with instructions. You can review these before you start your dressing change. Okay. These kits are set up just like a book. You're going to open them just like a book. If you can read the label where it says tear here, that's where we're going to open the book. Then you know you have the right side to open it. So you just tear it along the perforation and open it up using the corners. All right. We're going to open the top flap, and then here you'll see you have pockets. Pockets 1, 2, 3, 4, and 5 here, and they all have supplies in them. We're going to use all the supplies in this kit. Also, you'll notice there's instructions along with it. All right, so all you have to do is read the instructions. It says pocket 1, don mask. So I'm going to don a mask on myself. And then I'm going to don a mask on my patient or my mannequin here, my simulation here. Okay. Let's see if he has any ears. All right. All right, and we're going to place the second mask on the patient like we did. We're going to perform hand hygiene, and we're going to use these sterile gloves in pocket 2. Set the sterile gloves aside, and I'm going to grasp this hand hygiene gel. Okay, here it has a perforation on the back. We're going to apply gentle pressure while we open the perforation. If I do too much, it'll go squirting everywhere. So I'm going to sanitize my hands. All right, and then I'm going to don these sterile gloves. Okay. Just touching the edges here. All right, just touching the edges. All right, I don't want this to fold back on itself. These kits come with medium gloves. If you need larger or smaller sterile gloves, we'll have to get them from your supply closet. They only come with mediums. All right. In the next pocket, you will see some tape strips. We're going to use this tape strips to secure the lumen. If you feel like your patient is going to pull at the central line while you're removing the dressing, you will use these tape strips to secure the line. It also helps secure the line while we are adding pressure and pulling at the dressing. So I'm going to use this just to secure the line. I'm going to tape it right over these caps just to secure it like that. All right, I'm going to just use one strip today. The next pocket, and it says right here on the instructions, is an alcohol swab stick. I am going to use that if I can get it open, to saturate the old dressing to help remove the adhesive. All right, I'm going to start down here at the bottom and work my way up and just use this alcohol to help saturate and remove the adhesive. Okay, I'm going to start pulling off the dressing. I want to start here at the bottom and pull towards the insertion site. Pull up, okay? I'm going to remove the bottom part first, what we call the pants of the dressing, the bottom of the dressing. I'm going to remove that first. There we go. Slide that off. And then we're going to pull the dressing towards the insertion site. Okay, just like this. And when you pull off the adhesive, we have the securement tape there. The bow patch should remove right along with it. Just like that. Okay, all right. So I'm going to doff these gloves, hand sanitize, and then see what's on the next step. Next step is to remove the hand sanitizer and the sterile gloves and set them aside. Okay, set them aside. And we're going to lift the bottom of the kit, the bottom flap up, and also extend out the lower flap. Just like that. And it says right here in pocket 6, which is the next pocket, go ahead and sanitize your hands and don the sterile gloves. Gentle pressure on the perforation of this hand sanitizer package. All right, let's don these sterile gloves. Just touching the edges again. Oop. Toward just a little bit. All right. Let's pick this up. Using the cuff. All right, so in this pocket we will see a 4x4. This 4x4 is going to go right over the lumen so that I can touch this 4x4 and move the lumen, raise the lumen up to clean underneath there without breaking sterile field. So I'm just going to put it right over the securement tape or the needless connector and part of the lumen. In the next pocket, you will see an alcohol swab stick. We're going to use this to remove any debris that is on the insertion site or any adhesive that was left from the old dressing. Sometimes your patient or your mannequin will have small pieces of dried blood around the insertion site, so it will stick right to the swab stick, and we'll just remove it. The next pocket, we have CHG. We're going to take the CHG, crack it open.
Best practice: squeeze the CHG wand only once and allow the CHG to flow into the sponge. This prevents the creation of micro shards of glass in the sponge that may scratch the skin.
And we're going to scrub the insertion site. I'm going to use my hand right on, place it on the 4x4 to help secure the central line, and I'm going to do a 30-second scrub with the CHG. We're going to go up and down and back and forth, back and forth, back and forth, back and forth for 30 seconds. Now this is a simulated mannequin, so his central line is not sutured down, where patients will be more secure. But we're going to do this for 30 seconds, and it is a back and forth motion and up and down motion. All right, without, just like that. All right, for 30 seconds. Okay? All right, I'm going to let that dry. Okay, while I'm letting that dry, I'm going to go ahead and get my microbial patch ready. All right, it comes with a cotton tip applicator. We're going to open it up the package and place it on the sterile field. All right, and the microbial patch, the lettering goes up. Before I place it on the patient, I'm going to try to find the slit where the lumen will go. All right. Kind of separate the slit a little bit so it'll be easier to place on the patient. All right, and I'm going to use this to transfer it to the patient. All right, all right. And you can use this cotton tip applicator to place it underneath the central.
Best practice: position the slit in the CHG impregnated disc at 5 or 7 o'clock. This provides 360 degrees of protection at the insertion site and aids in removal.
All right, so the slit goes underneath there. It goes slightly distal to the insertion site. All right, discard that. The next thing we come to in the instructions is also this non-sting barrier film. We are going to place this right where the tegaderm or the dressing will go to help protect your patients from the adhesive. We don't put it on the insertion site, just around where the tape or the tegaderm is going to go. Put that in there, and we're going to let that dry. While I let that dry, I'm going to go ahead and get out my tegaderm, and this is what we call the shirt. This is the pants, and this is the belt of the dressing, okay? I'm going to remove the backing and discard that and show you the window. My microbial patch should go in the center of this clear window, okay? The lumen will go into the slit. I will try to cross the tape and the dressing, crisscross it underneath the lumen of the central line, okay? All right, I'm going to try to get this up. So I'm going to place the top part down over that. I'm going to use my 4x4 and lift up my lumen and crisscross my tegaderm and then lay my lumen back down. Not touching my patient's skin. I am going to do some gentle pressure to have the adhesive adhere to my patient's skin. I'm going to remove the tail or the belt. All right, place it on the side here. Now I'm going to remove the pants. So we're going to take all right, there it goes. Get it all off there. There's tabs on this, the pants of the dressing, right on the border of it. All right, you see the slit? I need the lumen to go in the slit. All right, so I'm going to push this up as far as I can so the border of the shirt will meet the border of these pants. Okay, and we're going to use the 4x4 to gently lift up the lumen, and we're going to put it right on there, as tight and as close as I can get it. All right, it's a little crooked. It's okay. There we go. I'm going to put this down, and then I'm going to smooth this out and apply gentle pressure to get it to adhere to your patient's skin. And we're going to gently remove the tabs, the corners. All right. All right. Now I'm going to take the belt. I'm going to take a pen, write today's date and my initials, and then I'm going to place the belt right over on this, grabbing the tabs, it does have tabs, right over this side right here where you can see there's a slight hole where the pants meets the shirt, and I'm going to cover that hole with the belt. All right, and remove the tab. Remove the tab. All right. Okay. There we go. I'm going to remove my 4x4 and my securement tape. All right. I'm going to remove my gloves. Doff my gloves. Hand sanitize. Doff my mask. All right, hand sanitize again. Now this central line has 2 needleless connectors. So we're going to change the needleless connectors every time we change the dressing, which is every 7 days. Okay, so since I have a nice clean work surface, I'm going to go ahead and set up for this needleless connector change. I'm going to put 2 saline flushes out on my area. All right, I'm going to need 2 needleless connectors. 1, 2. All right, we're going to clean and scrub the hub of these needleless connectors. So I'm going to put out several packets of alcohol. You're going to need a minimum of 6, basically 3 for each cap. All right, and also you're going to need 2 Curios caps. All right, I'm going to sanitize my hands again. And I'm going to don some gloves. This is a non-touch aseptic technique. All right. Before I can remove the old needleless connector, I need to scrub. All right, especially this hub where we touch all the time before I expose the central line, because it'll be open once this cap comes off. So I've got to protect it and clean it, scrub it for 15 seconds. All right, the whole thing, the leg, the needleless connector, especially this hub here, and the leg of the lumen. All right, got it. All right. I need to prime my needleless connectors first. Would be the first thing to do. All right. So let's prime these real quick. We're going to prime them up towards the sky to remove all the air. Like this. All right. Now I'm going to clean my cap. Clean the lumen, clean the leg for 15 seconds. All right, when that's all done, 15 seconds, you can remove the cap. Now this is completely exposed, so we're going to clean that too. What was covered by the needleless connector, we're going to clean it for 15 seconds and let it dry too. Really clean it because it's completely exposed now. All right, while I'm letting that dry, I'm going to remove my protective cap from my needleless connector. All right, it looks all dry, so I'm going to connect my new needleless connector. I'm going to pull back on the syringe and get blood return. So I'll know my central line's in place, and then I'm going to flush it with a pulsatile flush. I'm going to push in a little bit, pause, push, pause, push, pause, push, pause, push, pause, until I get down to 0.5 milliliters, and then I'm going to twist off my flush. I'm going to cleanse it again for 15 seconds because I did access it. All right, every time I access your needleless connector, we're going to sanitize the whole area, the needleless connector and the hub and the lumen for 15 seconds. And we're going to let that dry for 5 seconds, and then we're going to add a Curios cap. Okay, it's all dry. All right, now we're going to proceed with the next one. All right. I'm going to take another alcohol prep pad, and I'm going to clean, clean, clean. For 15 seconds, I'm going to clean the old needleless connector, the hub where we touch all the time, and the lumen. All right, for 15 seconds. All right, I'm going to remove this cap. There we go. And now that it's exposed, we got to clean it. Clean it really good. Another 15 seconds, okay? Because this is open right into your patient there. We're going to clean, clean, clean around and around the opening here for 15 seconds. We're going to let that dry, and while we let that dry, I'm going to remove the protective cap from my new needleless connector. Like this. All right. All right, I'm going to give that plenty of time to dry. And I'm going to attach this. I'm going to pull back on the syringe and get blood return, so I'll know my central line is in place, and then I'll use a pulsatile flush to flush out my new needleless connector. Push, pause, push, pause, push, pause, until I get down to 0.5, and then I'm going to remove my flush. I accessed it, so I'm going to cleanse it again. We want this to be as clean and as safe for your patients as possible. So when you access your central lines, we're going to clean. We're going to disinfect as much as we can. All right. Okay. When it dries, I'm going to apply the Curios cap. There we go. All done. All right. I'm going to go ahead and remove my gloves, doff my gloves, hand sanitize, and clean up my area. Okay. Remove your mask from your patient. All right, so that concludes this video on central line dressing changes. I hope you enjoyed it. Thank you for watching.